All right. So I'm going to gather all my equipment. I'm going to introduce myself. Hey, I'm Nick. I'm with the respiratory. I'm going to be doing some trach care on you and suctioning out your lungs. Hopefully make you feel a little bit better, a little bit cleaner. Okay. I am going to check the chart, make sure everything's cool. I'm going to check the monitor. I'm going to look at the patient's heart rate, their blood pressure, their pulse ox. I'm going to check what oxygen they're on. I'm going to look at their respiratory rate. I'm going to have a listen to their lungs. I'm going to have a listen to their lungs to see if there's an indication for suction. Okay? After I've done that, I have all my equipment in here. I'm going to check my suction pressure. And how do I check my suction pressure?
You pinch the tube.
I pinch the tube off. I fold it over, I pinch it off, and this is an adult patient, so what should my pressure be set to? 120 to 150, absolutely right. So if it's greater than that, I need to reduce it. If it's less than that, I need to increase it. Anywhere in that range, 120 to 150 is great. You are going to float onto the higher side to that 150 area if the patient has really thick secretions. Really thick, hard to remove secretions. If the patient has really thin secretions, then we might go down to the lower side of things in that 120 range. Because the least amount of pressure that we have to use, the better. Okay? So I am going to make sure I got that all set up. And now I'm going to apply my sterile technique. And again, I'm just touching the inside of this cuff. There we go. And I'm sterile, okay? Now I'm gonna make that decision on what hand is gonna be sterile and what hand is going, not just yet, I'm gonna go ahead, this guy was right here, and now I can touch this however I want to because both hands are completely sterile, okay? So I can go ahead and wrap this bad boy up, all right? I am deciding that my right hand is gonna be sterile. My left hand, still sterile right now, is now going to be clean. Okay, because I have to hyperoxygenate the patient. How long do I hyperoxygenate the patient? 30 to 60 seconds. Very good, both of you. Can I use either hand to do that? You can initially, but I got a sterile catheter in this hand, so I'm going to make sure that I'm using my left hand to provide that sterile or to provide that hyperoxygenation. What type of oxygen do I use? Does it matter what type of FiO2 I use on it?
It's 100%, isn't it?
100%. Okay, so I'm going to provide 100% oxygen. For a trach patient, I might have to bag them. If I don't have to bag them and they're breathing spontaneously, I can just hold that ambu bag right onto the trach. Or I can give them a trach mask and give 100% oxygen. Okay? So, whatever. So I am going to go ahead and grab the suction tubing right here, and I can touch that because this is just clean now. And I'm going to turn this guy so I can be on the right side like I normally would be. I am going to go ahead and attach it right here. I'll take my bad boy intercannula or suction catheter, and I'm going to insert it just until I get them to get a cough. Okay, what happens if they don't cough? What if they don't have a gag? Okay, well then you are going to insert it about 22 centimeters at 22 to 26 centimeters if you're going endotracheally. If you're going tracheally, then you're only going to go about 16 to 18. Basically, we want to go as much to make them cough as possible, but we don't want to go all the way down inside the lung. Okay, so then I am going to, how long can I intermittently apply suction to the patient?
10 seconds.
Good. 10 seconds ideal, up to 15 seconds. Very good. All right, now I suction out the patient. Cool. I can take this and I can toss it. This guy is still pretty much sterile. It's just what's been in the patient's lungs anyway. Okay, this guy is still just clean. All right, I can grab inside this and bring it on over here. All right, and we are just gonna follow along with the pathway that's suggested. So I've already done step number 3, correct? I've already suctioned the patient. I'm going to move on to step number 4 and remove and clean the intercannula. This is super easy. It's super scary the first time you do it, but it's super easy. So this guy, the ones over here are the clip All right, this inner cannula is way too big for that outer cannula, but it just clips into place. When I want to remove this inner cannula, I'm going to squeeze and remove, okay? When I have this one, this guy, and then you guys are going to be using this trach on the patient to do your thing. When you do this, you twist it counterclockwise, and then you can remove it. When you go to put it in, you're going to put it in kind of at an angle here, and then you're going to twist it clockwise, and it will lock in place. Okay, so I'm going to go ahead and twist it. If I was in a perfect world, I'd just take this, I'd launch it at the wall, try to make it in the trash can, I'd put a new one in. But we don't get to do that in our lab because you need to learn how to clean it properly. So, I am going to go ahead and take my little scrubber, and I'm going to clean the inner cannula. I'm going to have normal saline available to me. Generally, I will put it right inside this bad boy right here. It's like there's two different, how do I say that? What is that? Cups inside here? Huh? Yeah, compartments. There's two different compartments in here. And I am gonna go ahead and dip this in there, so hopefully soften it up a little bit, and then I'm gonna scrub it out, put it back in there, scrub it out again, make sure it's nice and clean. And look at that, it's really clean. Fortunately, it hasn't been in the patient yet. So I'm gonna set this clean guy right over to the side and keep it in a nice sterile environment, okay? Then, next step number 5, we are going to clean and examine the stoma site. So, I'm going to take my Q-tips and I'm going to go underneath. I'm going to clean right here. I'm going to clean the skin and I'm going to clean the plate itself. If I have to, I'll clean the front of the plate. That won't be nearly as nasty as the back of the plate. The back of the plate is going to be where most of the sputum is and what's going up against the skin itself. So we want that to be clean and clear of debris, okay? So I'm gonna go up underneath it, I'm gonna clean the plate off, I'm gonna clean the skin off. I'm gonna go to the other side, clean the plate off, clean the skin off. You have anywhere from 4 to 6 little Q-tips in there, and you can use all of them when you do this technique. So in here you also have your hydrogen peroxide, sweet. 2 different sets of them. You can use that to dip your Q-tip in to help with the cleaning process. Okay? All right. So I've cleaned the skin. I've cleaned the faceplate. Now I'm gonna make sure that I change the ties. Okay. So the way to work the ties, super easy. I already opened one, but I'll open another one. All right. So you have this guy right here, this is the main piece, and then you have the extension piece. If the patient has a really large neck, you are going to use this as long as you can. You know what I'm saying? You're gonna have the longest setting as possible. That's a big neck. But if the patient doesn't have that big of a neck, then you're gonna take this Velcro, you're gonna stick it down a little bit further, right there, and then you're gonna be able to tie it like that, and it's gonna make a smaller hole. Okay? So what I'm gonna do is I'm going to fish this through. All right, and I'm gonna take one side and go through the opening in the flange and attach. I'm gonna go through the other side and attach. And I don't want to just sit here and go, okay, I got it. Now I'm gonna yank it as tight as possible to make sure it doesn't go anywhere. How do I check to see if I have the right tightness to that trach tie?
2 fingers.
2 fingers, yep. Make sure that you can fit 2 fingers in there. If you can fit more than that, then you need to tighten it up. Okay? So that's how you check that. Once you've got the trach ties on there, then you're going to replace the inner cannula. And again, the inner cannula is super easy to replace. You are just going to slide it in, turn it clockwise, and it will lock in place nice and easy. Once I've completed this whole deal, I'm going to make sure that the patient is back on their proper oxygen settings. I'm going to look at the monitor, and I'm going to make sure everything is within range or right where it should was before I walked in. Should was. Then I'm going to document everything, and I'm going to leave. Okay? When I'm suctioning the patient, and there's a heart rate spike, at what heart rate increase do I stop the procedure I'm doing? 20. Anything over 20, I'm going to stop immediately. Okay? Return them, like re-oxygenate the patient, return them to their previous oxygen settings, and then get out. And document. All right, so what do you think? Not to do, oh wait, I guess I didn't put the, put this on. Got ahead of myself. All right, so before I actually put the trach tie on, I should have done that. I apologize, I got all excited. All right, so this right here, the split right here, I'm going to go up under each side of the flange and up over the top. And it's gonna look like that. Okay? Why is it gonna look like that? And why do we need that? Because there is going to be leaking around the outer cannula. And it's gonna like just soak this. Sometimes it'll be like drippy, super yucky. But I'm not gonna sugarcoat it. You'll see that quite a bit. So to remove it, it's the easiest thing in the world. You just pull it out. All right, to put it back in, again, just work its way up on either side. You call it a day. And then you can put the trach ties on. You want to do this before you put the trach ties on because it's going to be really hard to get this up underneath it if the trach ties are already in place. Cool beans? Cool beans. All right, so I can only have one person come up at a time to do this. While I am doing this, I would encourage, like with each of you guys individually, I would encourage you guys to work together to complete the lab questions, and I would also encourage you guys to possibly check each other off on sterile suctioning technique. While you guys are waiting to do this aspect. Okay? Alright, so why don't I have one of you guys come on up here and